Peadar Tóibín.
I welcome and fully support this motion here tonight. It has been one of the biggest mistakes of the whole pandemic that so many key life and death services have been stopped by the previous government and kept closed by this government. For the last number of months, we in Aon have consistently called for the reopening of the health services. We've said it over and over again. These services must return. And back in June, I raised it with the then Minister, Simon Harris. And when I asked it, the Minister, he confirmed to me that he was aware and he supported the decision to cancel cancer screening services in March. So this wasn't some kind of mistake. This wasn't an aberration. Cancer screening was cancelled under the authority and permission of the former Minister for Health. Now, whenever I ask the government about concerns over non-COVID mortality rates and what they are at the moment, the response has always been by the government just to go to the health service. Now, the problem is, what's the point of sending people to the health service when much of those services have been either paused or stopped? And it was ludicrous. Right through the lockdown, we had a situation where the HSE continued to advertise cancer screening online, even though those services were not in operation. And many people who were worried about cancer felt that they were being pushed down a cul-de-sac. Now, for months, again, I've been asking the previous government and yourselves, what is the cost in terms of mortality and morbidity with regards to the cancellation of services? And for months, the government has given me the equivalent to a political shrug. Just a week ago, the Taoiseach organised a meeting of party leaders, NEFIT and the CEO of HSE. And again, I put these questions to those individuals. I was told a week ago that I'd have an answer, but there's no answer as of yet to those. So, I would ask you, Minister, if you can address it. Why has the government not sought to investigate the cost of the cancellation of services in terms of mortality and morbidity? In Britain, it was estimated that 35,000 people would lose their lives to cancer due to the COVID pandemic. Yet nobody in this government has thought it worthy to carry out such an investigation here. The fact that mortality and morbidity associated with the closure of these services remains an enigma to this government is a national disgrace, an absolute national disgrace. Because I hear on a regular basis the HSE and NEFIT and the government say that they're making these decisions on the basis of scientific evidence and all of the information. But if you rule out a significant proportion of the equation of the excess mortality that's happening now, which is the cancellation of these services, if you rule out even investigating it, even analysing it or understanding it, well, you're simply not making those decisions on the basis of all the facts and the science necessary at the moment in time. And it's interesting that the current Minister for Health, Stephen Donnelly, was also asking these questions, along with myself, when he was on this side of the chamber. And unfortunately, Minister Stephen Donnelly's voice has become silent on these issues. Now, according to the CSO, in this latest report, it says that there have been, COVID has caused between 850 and 900 excess deaths in Ireland in the 5 months from the start of March to July. Now, these are deaths that have occurred that would not have occurred in that period of time. This is a figure down from 1,072, which was the original reported excess death level, and it's obviously much lower than the 1,700 deaths that are being reported on the media every day. COVID is a serious threat. We have to take COVID seriously, and we must all do what we can to reduce the number of deaths that occur because of COVID. But cancer is a significant threat. 9,000 people die of cancer every year. We have to take it seriously, and we need to do absolutely everything we can to make sure that we reduce and prevent those deaths. And it's been mentioned in the chamber a number of times, there's very few people in this chamber that have not been touched either personally or indirectly by cancer. And just 8 weeks ago, I received one of those phone calls that people don't want to receive. I received a phone call to say that I had skin cancer, that I had a mid-sized melanoma tumour in my scalp. And luckily, maybe unluckily, but because of the severity of the issue that I was lucky enough to get timely treatment by fantastic doctors and nurses, and I owe them so much from that. So since then, I've had 2 operations on my scalp. A big chunk has been taken out. My 4-year-old son said to me, he says, "Dad, your head looks like it's caved in." And I said, sometimes it feels like it has caved in, to be honest. But we're on the road to recovery, thankfully, because of all of that treatment. But not everybody in that situation is so lucky. Many people, and I've been speaking to doctors around the country, many people who are currently cancer symptomatic are not getting the treatment that they need. Many are suffering significantly delayed diagnosis and treatment. And these medics that I've been speaking to are saying that some of their patients are simply not going to make it. Now that's a startling and shocking thing. And they are victims of this COVID crisis as well. And they should be treated equally in this whole process and making sure that they have equal access to health care, in my view. So with cancer treatments, the timely treatment is of the essence. Nobody should be waiting months for chemotherapy. We should strive to abolish waiting lists altogether. Imagine in this country if we did that. Imagine the number of lives that we would save. And screening does save lives. Early detection and treatment does save lives. And what I find really mind-blowing at the moment is the fact in September 2020, you can get your hair cut, but you can't actually get a breast check screen. It's mind-blowing that in September 2020, you can get your hair cut, but you can't have a face-to-face consultation if you have a mental health issue. You can be in the physical space of somebody to get your hair done, but you can't be in the physical space to somebody to carry out something that is maybe an existential threat to your life. And that has to change. And it shows the priorities, the confusion of priorities currently of the government when that actually happens. Now, budget date has been set. And this is a real opportunity for you personally, Minister, and for the Senior Minister in this department. It's obviously the first budget where you will be a minister. It's a test to whether all the years on this side of the chamber have been talk, or actually if there's actually substance to this whatsoever. I would ask for the telephone to be turned off, because it's just, you lose the train of thought in this debate if you're interrupted so many times. I want to raise just a couple of issues just in the 2 minutes that I have that are related. The first one is in relation to Mary Bartley Meehan, apologies, the slip of the tongue. Mary is a constituent of my own in County Meath, and tragically she lost both her son and her husband to COVID in a nursing home in my county just a number of months ago. I'm slow to even discuss her particular case, because her case is absolutely so shocking, but I think it's important to discuss it. Her husband obviously had terminal cancer, and his face became infested by maggots by the time that he got to a hospital. And again, I don't say that for shock tactics, but I say it because Mary, in the last couple of weeks, has actually looked at a video recording of that situation that her husband was in. The reason she looked at that video recording was because she said she had to know the full information for her to be able to fight for her husband. She is fighting. Golfgate was serious. Nobody has resigned. Nobody has lost their job. There's been no investigation for Mary Bartley Meehan. And it's just mind-blowing that this is what happens in Ireland. And I'd ask you, Minister, if you can, to take the bull by the horns in this issue and make sure that Mary isn't pushed around from Billy to Jack any longer in this. I also just want to raise, if I can, in a couple of minutes of less, is the issue of cervical check. And in recent days, it has emerged that the governor of Florida is ordering state agencies to break ties with Quest Diagnostics after that lab mistakenly delayed reporting of results of nearly 75,000 COVID tests. It sounds familiar. Delays, mistakes, IT glitches. I've spoken to Sharon Butler Hughes, the woman who triggered the McCrack report last year. She's calling for reopening of testing. The McCrack report recommended that we put women first. Outsourcing cancer screening does not put women first. We need to see funding used towards accrediting our laboratories here in Ireland so that we don't have to rely on labs abroad, which have the reputation, obviously, of making mistakes over and over again. Minister, this is another issue in your grasp. Use the opportunity that you have. Thank you.